42-year-old woman is evaluated for depression and poor sleep. She also has muscle weakness, anxiety, and kidney stones. Her blood pressure is elevated, calcium is high. Which of the following is best explains this patient hypertension? So we need to know among these choices here, Shabab, what will fit into these features, okay? And the one that is causing such things, it can cause renal stone, it can cause hypercalcemia, and it can cause neurological dysfunction in some form, like in anxiety, psychiatric features, depression and anxiety, is hyperparathyroidism. So primary hyperparathyroidism can cause hypercalcemia, of course, and it also can cause hypertension. How does it cause hypertension? Maybe by increasing renin secretion or sympathetic hyperstimulation or arterial vasoconstriction. So we know these. We know the sympathetic that cause vasoconstriction worldwide, and also, all over the body, including the heart, and vasoconstriction. Arterial vasoconstriction also is there, can cause increased blood pressure and increased renin, because renin is the origin of all these. Because renin, what does it do? Renin will help the secretion of aldosterone from the suprarenal gland, and aldosterone will activate the system and result in production of angiotensin II. Okay, so here there are also some features of hypercalcemia. It can cause kidney stones, muscle weakness, depression, poor sleep, polyuria, and constipation. So they can give you combination of other features that tells you it is primary hyperparathyroidism. Just to link يا شباب, عشان just to integrate things, it's good to just have a quick idea and quick review of the parathyroid hormone. It works mainly in calcium homeostasis, so it causes calcium reabsorption in the kidney. So calcium will go back to blood. Also, calcium absorption from the GIT. Parathyroid hormone also activate vitamin D. Parathyroid hormone also cause release of calcium from bone. Back into the blood. So all these can lead in, if there is a tumor or adenoma in the parathyroid gland, secreting parathyroid hormone will result in hypercalcemia. Okay, hypercalcemia, neurological, or let's say more muscular. It causes psychiatric symptoms. It can cause polyuria and constipation. And of course, renal stone. So they can give you in the question any form of combination between these things. And it is primary because the source of hyperparathyroidism is adenoma or something, parathyroid hormone produced from the parathyroid gland itself. So that's called primary hyperparathyroidism. Hypercalcemia leads to accumulation of salts in various tissues, calcification including arteries, heart muscles, the resulting left ventricular hypertrophy and reduced arterial flexibility and risk for arterial hypertension. So these are some other explanations how hypertension can develop and hypercalcemia by promoting rigidity of the arteries and also can cause. These are the clinical features of hyperparathyroidism. It can affect the heart, urinary tract, musculoskeletal, digestive tract, more susceptibility of acute pancreatitis, duodenal ulcer. So this is a nice checklist and summary of the clinical features of primary hyperparathyroidism.